Hello, welcome to Early Beginnings for Lifelong Mental Health. I'm Dr. Justine Pavlukevich. I'm a licensed clinical social worker and a mental health therapist. I also am a professor at the City University of New York. I teach human services as well as disability in the family. And I'm also a board member here at Freedom from Fear. And Freedom from Fear is a mental health education advocacy program, and we're on Facebook. You can check out our website at www.freedomfromfear.org. You'll find a lot of information about mental health, about children, about families, so I encourage you to check it out. So let's begin our workshop number 2, which is specifically about anxiety and children. So what we're going to do is we're going to look at what is actually an anxiety disorder, what are the root causes of anxiety disorders, what do we know about children and anxiety specifically, and what is the treatment for children with anxiety. So why is it important that you, the caregiver, be part of this process, and how can you assist in this process with your child? So these are the 6 questions we're going to be looking at today. So what is an anxiety disorder? So, anxiety, can it be normal or is it not normal? So we do know that having anxiety is normal, and sometimes it's good to have anxiety because it tells us that there's something might be dangerous, or sometimes when we go through something that's uncomfortable, it's normal to have some feelings of anxiety and intensity with that. Hopefully at some point the dust will settle as things get better, or sometimes the perspective with the person that they're having will get better. So when is it not normal? Okay, let's take a look at this. So anxiety is not normal when it does cause intense discomfort from some excessive or unreasonable fear. It can also have some form of panic symptoms or anxiety symptoms that go along with it. There's definitely physical symptoms that occur with a panic attack and anxiety in general. The situation may be endured with distress and anxiety, meaning that going through something, the person still feels anxious and they can't calm themselves down enough to the point where they can relax and enjoy what's going on, or if it's a tense situation, deal with the situation. So children sometimes don't always have the coping skills to deal with this. Sometimes people avoid anticipated situations. So people will say, well, I think I'm going to be anxious if I go to this party, so therefore, I don't want to go. Sometimes children will also use compulsive behaviors to decrease those anxious feelings. So what I mean by compulsive behaviors is they will do something specifically to make themselves feel more in control. Sometimes it can impair the person's social, occupational, vocational, and other important areas in their life. And what do I mean by this? Sometimes it can affect their relationship with family, whether they socialize, whether they go to school, whether they decide whether they want to go on outings or not. So sometimes anxiety can actually immobilize a child where they're not necessarily being free and having fun and looking forward to things. So what are the root causes of anxiety disorder? So a lot of times people say, well, what is it? What's going on with my child? Is my child just not going through something as well as they should be going through it? Is the fact that it's the first time they're going through something? Is this normal for my child to have anxiety? Sometimes it can be a genetic or what we call hereditary factor. So we often find that anxiety does and can start in the family and can be passed on from one generation to the other. Is it the environment? Is it the fact that maybe their people around them are anxious and they've learned anxious types of coping skills? That could be part of it. Or is it the fact that the environment in itself is not a calm, natural environment? And does that cause some kids to have a little bit more anxiety than others? And what we think about is that sometimes it can be a chemical imbalance. We hear this often. What's a chemical imbalance? What is it's too much or too little of the brain's molecules not able to communicate with each other properly. So if somebody doesn't have a chemical imbalance, it doesn't necessarily mean they don't have anxiety, but what happens is soon enough the molecules will communicate with each other and the anxiety will subside. For those with a chemical imbalance, sometimes this doesn't always work correctly in the brain. So what do we know, though, specifically about children anxiety? It is one of the most common mental illnesses in children. Okay? A child can often have these types of anxiety disorders. These are just some anxiety disorders. So they can have generalized anxiety disorder, where a child will find they're too anxious in situations and cannot calm themselves down. They think about things too much, too hard. Now, we all think about things a little too much and too hard, but sometimes what happens is that when a person cannot let go of things, then we consider that an anxiety disorder. Panic disorder, or anxiety disorder, you can use either name for it, but within a panic disorder, a child will actually have symptoms. What will happen, within 10 minutes, they feel intense discomfort and anxiety. They feel like their heart is racing or coming out of them. Some people wonder if they're having a heart attack. They're not having a heart attack. Because sometimes what happens with panic attacks is that not only they will feel physical symptoms, but also the mind will start racing and start thinking of horrific things like, oh my God, I'm having a heart attack. I have to go to the hospital. I have to go to the emergency room. So sometimes through an anxiety attack, people will also feel that they're dying, or they're going to have a meltdown, or they're going to faint, or because they're getting dizzy, or they're feeling weak. Also, they feel that their throat is closing, so they worry about, am I choking? Okay, am I choking? Am I going to stop breathing? And their muscles can become very tense. They also may have headaches, nausea, tingling. So there's many parts of the body that can exhibit some of these anxiety symptoms as well. Separation anxiety is when the child is having difficulty doing things on their own that usually for a certain age the child would begin to do things on their own. So if going to school is a problem and the child doesn't want to go to school in the morning and it's a tug of war, we want to look at is separation anxiety happening here. We're not talking about the first day of school, we're not talking about the first day of high school or beginning something or the first party that a child is going to. We're talking about something that the child is familiar with yet doesn't want to engage in, and they do not want to do things alone. So for example, maybe playing alone in their room, maybe doing, being in the kitchen by themselves, maybe watching TV. Sometimes they always want to feel that reassurance and someone is always there. That's fine for kids who are very young, but as we look at children and look at the milestones, they should at some point get some more and more independence with that. Okay, obsessive compulsive disorder, which is also known as OCD. In children, this can be found, and in children it can be found where they will do rituals beyond hand washing or checking whether the stove is off. Sometimes with children it can be a little bit more specific to what they're feeling and trying to get in control. So for example, they may be paying attention to what people are saying and counting the words. And if they don't count the words, then something is going to happen to either that person, them, or someone that's very close to them, or a disaster will happen. So some rituals also have a component of not only doing the ritual, but also putting catastrophic thoughts to them as well. Also, post-traumatic stress disorder, PTSD, is when a child has either had a trauma or witnessed a trauma. So, for example, had a trauma could be is maybe their house went on fire, or maybe they got bit by a dog, or they were in a hospital and had surgery and is uncomfortable, with all the needles and the tubes, and that can be a trauma in some ways. Or witnessing a trauma could be them witnessing somebody getting beaten, somebody get killed, somebody being injured, someone close to them in a car accident. Those kinds of things could be post-traumatic stress disorder. And children do exhibit those kinds of symptoms. What can happen is through that they can have a lot of nightmares. There may be anxiety, there may be fear. Some of it may look like separation anxiety. They don't want to be alone. They also may have a lot of nightmares too. So, what is the treatment for children with anxiety? The most common treatment is cognitive behavioral therapy, which is CBT. Cognitive, if you think about it, cognitive is what we think. Behavioral is what we do. And if we put that together, we say, okay, what are you thinking and how is that affecting your behavior? What behaviors are you doing that that you can calm some of your thoughts as well in conjunction with it. So CBT is very good for people who have anxiety disorders, and children can be taught cognitive behavioral therapy skills and techniques to try to change their thinking, try to look at the reality of what's happening, and to see and put in place other coping skills and thoughts that might help their behaviors, or or get some of these behaviors to dissipate and put in better coping skills and behaviors. The other thing is that we sometimes do give children medication, but not always. Medication is usually the last resort. We kind of take a look at a psychiatric evaluation. We also give the child therapy. When that's not working, then we maybe look at medications, but not always. Why? Because sometimes medications are not made for children, so we don't tend to always use that as a first coping skill for treatment. So, why is it important for you to be part of this process? Because when your child is fearful, it is better, that you're there. You know what's happening. You're going through it with them on some level, so that they're not alone. They're not alone in this. You also want to give correct messages to the child, because sometimes with anxiety disorders, the child gets their own messages in their head that are unclear, incorrect, and sometimes distorted. And sometimes distorted to the point that they begin to believe their messages, and they begin to allow the messages to affect their behavior and their decision making. So you want to correct those messages. But you got to know what those messages are first. So you can also remind the child of what kind of coping skills to use at particular times. If they have separation anxiety, you can begin to talk about some of the things. Okay, before you're going to go to school, let's think about tomorrow. Let's look at some of the coping skills we've been learning. So you can kind of remind them. Sometimes when you're also in the middle of something and the child has an anxiety attack or panic attack, you can say to them, okay, let's start using your breathing techniques. So you're going to know these techniques so that you can pass them on to your child if your child is in the middle of something and forgetting to use the skills. So you want to do the skills together, such as breathing as well. So for breathing, one of the things that we begin to do is we put our hand on our heart and we put it on our stomach. And what you do is you take a very deep breath in, and then you hold it for about 8 seconds, and then you let the breath out. So I'm going to do it very quickly for you. I love doing this one because it actually helps me to just center and focus. I could do it in the car. I could do it before I'm going to bed. I can also do it where some people don't even realize that I'm taking this nice deep breath. Again, don't forget, the hand is on the heart, the hand is also on the stomach. What should happen is the stomach should rise, not the chest, so that you know you're doing it right. So sometimes breathing is a very good coping skill for anxiety disorders and symptoms. So the other thing is you're going to have consistency, and you're going to reinforce that these are the coping skills we're going to do. So consistency over and over, practicing certain coping skills is very helpful for the child. You're also going to be the person who's going to explain things to others, so that the child's needs and what's happening, others understand. Sometimes people say, well, why doesn't your child, just get with it? Why don't they just, go to school? Why don't they just, go to the party? Why are they so anxious? Just get over it. And sometimes you need to be that voice and explain to the person what's really happening, and that your child has a specific disorder, and these are some of the symptoms, and these are some of the coping skills and needs that the other parties may need to pay attention to. Your child is your responsibility. Your child's, any type of disorder your child is having is your responsibility. So that's another piece of being part of it, and certainly enhances the greater success for your child. So how can you assist in the process? You can do some work at home. First, is a professional evaluation needed for your child and the symptoms? Yes, no, why not? Think about that. You can do the breathing exercises with your child. And also take a peek at the following website. It is our Freedom from Fear website. There's tons of stuff about anxiety disorders. So until I see you next at the following workshop, be well.